So my name is Lutsch. I'm a PGY1 in Anesthesiology at NOSM, specifically based out of Sudbury. I completed my med school at Queen's, and I'm originally from a small town in southwestern Ontario called Pointe-aux-Trembles. So I love rural medicine, particularly because I'm from a small town and I grew up in a rural setting, and I was able to further that the love for rural medicine doing an integrated clerkship program at Queen's. I spent about 8 months in a community called Cobourg, about halfway between Toronto and Kingston, and there I really came to appreciate the value of training in a small center, from seeing patients in clinic to seeing them in the OR and having the opportunity to follow up with them afterwards, sometimes even following up with them in the community, whether it's at the arena or the grocery store. And that kind of patient-physician relationship was something that I really valued, and was something that I wanted to get a piece of by training at a smaller anesthesiology program, and Sudbury was as good as it gets. So I'm very fortunate to have one co-resident in my year. There are 2 residents in the anesthesiology 5-year program at NOSM per year. That's about 10 of us total, but we also have the opportunity to train with FPA or family practice anesthesia residents who have completed their 2 years of family medicine and have a special interest in pursuing anesthesia as well. So there's one FPA at the Sudbury site, and there are 2 at the Sault Ste. Marie site that we attend academic half day with, and every now and then they come for sim days and wellness days in Sudbury. So I suppose we're really about a group of 5. So building off the last question, I love that we are a small cohort. Everybody is so kind, so supportive. The senior residents were really good at helping us kind of gain independence in those first few months. And we actually do something called buddy call, where we do the first few shifts of residency with one of the more senior residents before we start taking independent call. That allows for kind of those mentorship opportunities to start, and we also see the senior residents and our other residents at academic half day, trouble rounds, grand rounds, resident-led rounds, and you can really see that it's a cohesive group that knows each other well. And I think that extends beyond just the resident group into our interactions with staff. When there's only 2 residents per year, staff know your name, they know what you're good at, they know what you're working on actively, and they can give you really appropriate feedback to enhance your skills, which is really important in a discipline like anesthesia, where building that relationship of trust with your staff allows to facilitate more independence in practice. So without a doubt, staff here are fantastic. When I've had difficult days in the past, there have been more than one person who's reached out to me to debrief or as a mentorship opportunity, and I really value that at NOSM, and I think they really create a community and a family here for residents. So a lot of people might have a misconception of anesthesia, that we don't really interact with patients that much. And while that might be true when you comparatively to other specialties, I really value the unique interactions that we have in patients. You know, we have a limited window to build trust and get to know the patient and really allow them to put their lives in our hands. And I think that's a really, it's a privilege, and it's something that there's definitely an art to. I think whether it's coaching patients during their C-sections, presenting different options for an anesthetic, there's really that social aspect that is really key. And as I'm working on developing my own style, I have some excellent role models that I try to emulate, and it really creates a unique experience. Sure, patients don't always remember your name, but every now and then they do remember, I had that anesthesiologist before and they made me feel so safe and so comfortable. And I think that it goes without saying that that's one of the best parts of the job. So I had the opportunity to be part of the SRPC, or Society of Rural Physicians of Canada student committee while I was in med school, and I'm going to continue that involvement on the residency side of things with the SRPC's residency committee. A big highlight of that is attending the Rural and Remote Conference every year. And I also have the opportunity to be one of the elected members of PARO. And PARO is essentially an organization for residents that advocates on behalf of its members, addresses professional or educational concerns. And my role as social lead is to kind of foster a sense of community and organize social events for NOSM residents, which unfortunately is all virtual right now, but there's still some wonderful events like trivia nights and virtual escape rooms. Residents are required to work on a research project, and as an R1, I'm just in the process of figuring out what my kind of niche and interest is in anesthesia, and I'll be finding a mentor and finalizing a project for that in the year to come that I'll have the 5 years of residency to complete. So I'm definitely an outdoorsy person, but my favorite thing to do that I did in Kingston, I took up biking and mountain biking there, and I've been able to bring my gravel bike and my mountain bike to Sudbury, and I really enjoyed the trails around here. There's some beautiful parks like French River and Killarney that are just about an hour away, and I haven't made it to Manitoulin Island yet, but I look forward to exploring the outdoors there. So there's never a dull moment as far as outdoorsy things to do in Sudbury. So I'm not too picky. I'm not too sure where I'll end up working. I definitely chose Sudbury because it's the size center that I think is the right fit for me. I'm not too much of a city person given my rural upbringing, and I think Sudbury is like the perfect size place for somebody who still wants to have that kind of small town vibe and maybe live a bit outside of the academic center while having the breadth and depth of scope of practice that a tertiary care center like Health Science North provides. So any kind of center, even Health Science North itself, would be a good fit for me. I would say if you're interested in rural medicine, the best way to kind of pursue that interest is to just try and get out there. Organizing electives, sometimes you can negotiate doing core blocks at different medical schools and doing those core blocks in smaller communities. That was something that I did while I was in med school. I was able to do some additional blocks at my rural clerkship site after chatting with staff and chatting with my program coordinators. And it's just a really nice opportunity to see the scope of rural medicine. It's hard to describe, but the family doctors especially who are doing all of these different things and are really the backbone of healthcare in many of these communities. For example, I went to Deep River in my first year of medical school, and the family docs there were so impressive. And I never would have had that opportunity if I hadn't gone out and got it. So I definitely recommend that even in your first year, look for programs either through the ROMP program in Ontario. Can facilitate some of these opportunities in first and second year, and ROMP and ERMAC for Eastern Ontario facilitate opportunities for electives in third and fourth year. And of course, reaching out to your program coordinator, core block coordinators, and letting them know that you are interested in kind of leaving the home site for some things really goes a long way, and that you just need to advocate for those opportunities for yourself.